So I've just rotated the model round, so we're now looking at a plantar view. So we're looking at the inferior surface of the foot. So I'll just remove away the plantar aponeurosis and we'll take a look at some of the muscles in the plantar group of muscles. So in the plantar group you've got 4 different layers. So you've got this first layer, which is the most superficial layer, and then 3 other layers which I'll come on to talk about. So these muscles form a lot of the soft tissue bulk that you can feel in the foot. So I'll start with this central muscle. So there's 3 muscles in this first group. So you've got the flexor digitorum brevis muscle, you've got the abductor hallucis, and the abductor digiti minimi. So right in the middle here we've got the flexor digitorum brevis muscle. So this originates on the calcaneus, on the medial process of the calcaneus, and it forms 4 tendons which insert onto the middle phalanx of the lateral 4 digits. So it inserts on the sides of the middle phalanges of the lateral 4 digits. So just like in the hand, you've got the flexor digitorum superficialis and the flexor digitorum profundus muscle. So in the hand, the flexor digitorum superficialis splits and it inserts on the middle phalanges, and it allows the deeper tendon, the flexor digitorum profundus, to pass through. So it's exactly the same in the foot. So the flexor digitorum brevis muscle, which is this muscle here, is analogous to the flexor digitorum superficialis. So because it's the superficial muscle, and then it splits and inserts on the sides of the middle phalanx to allow the deeper tendon, so the flexor digitorum longus muscle, to pass through. So the flexor digitorum longus is analogous to the flexor digitorum profundus because it's the deep tendon. So what this muscle does is that it flexes the lateral 4 digits at the proximal interphalangeal joint. So this muscle is innervated by the medial plantar nerve. So just medial to this muscle, we've got this muscle. This is the abductor hallucis. So you can feel this in your foot. It makes up a lot of the bulk that you can feel in the medial side of your foot. So this originates on the medial process of the calcaneal tuberosity, and it inserts at the base. It inserts medially at the base of the proximal phalanx of the great toe. So this muscle can flex the great toe at the MTP joint, and it also obviously abducts at the MTP joint, as the name suggests. So the third muscle of the first layer is this muscle here, the abductor digiti minimi. So this muscle sits laterally and it abducts the little toe at the MTP joint. So this has got an origin on the lateral side of the calcaneal tuberosity, and it also stretches across to the medial process. So it originates on the medial and the lateral process of the calcaneal tuberosity. So it's got quite a large origin, and then it runs forward and it inserts at the base of the proximal phalanx laterally. So it abducts the little toe at the MTP joint, so it brings the little toe away from the midline. So the abductor digiti minimi muscle is innervated by the lateral plantar nerve, and the abductor hallucis is innervated by the medial plantar nerve. So those are the 3 muscles of the first layer. So just a quick note about abduction and adduction in the foot. So in the foot, abduction and adduction are defined in relation to a longitudinal axis that runs through the 2nd digit. So abduction is any movement away from this axis, and adduction is any movement towards this axis. This is the same as in the hand. So abduction and adduction are defined relative to a midline that runs through the middle digit. So abduction is movement away from this line, and adduction is movement towards this line. So it's just to clear up any confusion that might arise, because when we talk about abduction and adduction in the rest of the body, we talk about it in relation to a central midline that runs through the centre of the body, So abduction is movement away from this central midline, and adduction is movement towards this. So in the foot and hand, the foot and hand have their own midlines. So next we've got the second layer of muscle. So I'll just remove this superficial layer and we'll take a look at those. So immediately deep to the first layer, you've got the extensor digitorum longus tendon. So this is the tendon which passes through the flexor digitorum brevis and it inserts distally on the lateral 4 phalanges. So the muscles of the second layer are related to this tendon because they lie at the same level of this tendon. So we've only got 2 muscles in this layer. It's quite an easy layer. So in layer 2 we've got 2 muscles, in layer 3 we've got 3 muscles. So in this second layer we've got the quadratus plantae and we've got the lumbricals. So the quadratus plantae muscle is this muscle here which lies posteriorly. So it's got these 2 heads, as you can see. It's got a medial and a lateral head. So the lateral head originates on the lateral process of the calcaneus, calcaneal tuberosity, and the medial head originates medially on the calcaneus. So these 2 heads form this tendon which inserts onto the lateral side of the flexor digitorum longus tendon. So you can see it attaching to the tendon here. So because of its attachment on this tendon, it actually just helps this tendon to flex the lateral toes, so toes 2 to 5. So this muscle is actually innervated by the lateral plantar nerve. So that's the quadratus plantae muscle. So next we've got the lumbrical muscles. So we've got 4 lumbricals. So just like in the hand, the lumbrical muscles originate from the sides of this tendon. So this is the flexor digitorum longus, and in the hand they originate from the sides of the flexor digitorum profundus muscle. So just like I mentioned before, the profundus muscle is analogous to the flexor digitorum longus muscle. So we've got these 4 lumbricals. So the first lumbrical originates from the medial side of this tendon to the second toe. So this only has one origin, whereas the other 3 actually originate from the adjacent sides. So these are bipennate muscles. So they have two sets of fibers which converge onto this central tendon. So they originate from the adjacent sides of the flexor digitorum longus tendons, and they then insert onto the extensor hood of these lateral 4 digits. So because of their insertion onto the extensor expansions, they actually can flex the MTP joint while extending the interphalangeal joints. So the lumbrical muscles are innervated by the medial and lateral plantar nerves. So the first lumbrical is innervated by the medial plantar nerve, and the other 3 lumbricals are innervated by the lateral plantar nerve. So that kind of makes sense. So those are the 2 muscles you have in the second layer. So remember, second layer 2 muscles, third layer 3 muscles. So I'll come on to talk about the next layer now. So I'll just remove away the second layer and we'll take a look at the third layer. So the 3 muscles you have in the third layer are associated with the little toe and the big toe. So with the little toe you've got the flexor digiti minimi brevis, and related to the big toe you've got the adductor hallucis and you've got the flexor hallucis brevis. So first we'll just take a look at this medial muscle, so the flexor hallucis brevis muscle. So you can see it here lying underneath this tendon. So this tendon runs inferiorly to this muscle, and it's the tendon of the flexor hallucis longus muscle. So the flexor hallucis brevis muscle is quite interesting because it's got two origins and 2 sort of heads where it inserts. So you can see one origin on this bone. So this is the one of the lateral tarsal bones, so it's the cuboid bone. And this tendon here is the tendon of the tibialis posterior muscle. So the medial side of the flexor hallucis brevis muscle actually originates on the tendon of the tibialis posterior muscle, and laterally you've got this origin on the cuboid bone. So then anteriorly, where the or distally where this muscle inserts, it actually has two heads. So this is shown a little bit short of where it actually inserts, because this is still the end of the metatarsal, so the head of the metatarsal. This muscle actually inserts medially and laterally on the base of the proximal phalanx of the great toe. So it kind of like it's shown with its two heads here, so splitting medially and laterally, but it actually inserts a bit further up on the base of the proximal phalanx of the great toe. So this muscle is innervated by the medial plantar nerve, and its function is to flex the big toe at the MTP joint. So next we've got the adductor hallucis muscle. So we've got this in the hand as well, so it's exactly the same. It's got a transverse head and an oblique head. So the transverse head runs horizontally across the foot, and it originates on the deep transverse metatarsal ligament. So you can see this ligament here running across the MTP joint. So it originates on the deep transverse metatarsal ligament and the plantar ligaments of these lateral three toes, and then it inserts at the base of the proximal phalanx. So again, for some reason it's shown a little bit out of place here. It's shown inserting on the metatarsal, whereas it obviously inserts at the base of the proximal phalanx, so a bit further up here. And then you've got the oblique head. So it's called the oblique head because the fibers are angled obliquely. So this muscle originates on the bases of metatarsals 2 to 4. So these metatarsal 2, 3 and 4. And it also has an origin on this tendon here. So if you remember from my other tutorials, this tendon is the tendon of the peroneus longus, or the fibularis longus. So it enters the foot laterally and crosses over underneath the cuboid bone to insert medially on the foot. So the oblique head of the adductor hallucis muscle originates on the tendon, this tendon, and also the bases of metatarsals 2 to 4, and it inserts at the base of the proximal phalanx of the great toe. So as the name suggests, this muscle adducts the great toe at the MTP joint, and both these muscles are innervated by the lateral plantar nerve. So finally we've got this muscle here, this little muscle, the flexor digiti minimi brevis. So this just actually means the flexor of the small flexor of the smallest toe. So as you can see, it originates on the base of the fifth metatarsal, and it inserts laterally on the base of the proximal phalanx of the little toe. So it flexes the little toe, and this is innervated by the lateral plantar nerve. So this muscle also originates, like the oblique head of the adductor hallucis. This muscle actually also has an origin on the fibularis longus tendon. So this tendon is shown slightly proximal to where it should be. So you've got this groove here on the cuboid bone. So that this tendon actually runs more like this in this plane. So this flexor digiti minimi brevis muscle also originates on the peroneus or fibularis longus tendon. So those are the three muscles of the third layer of the plantar group. So hopefully you're seeing some similarities to the muscles of the hand now. So remember my analogy to the flexor digitorum superficialis and profundus with the flexor digitorum brevis and flexor digitorum longus. And some of the muscles I've talked about just now are similar to the muscles of the thenar and hypothenar eminence in the hand, but you don't have an opponens muscle. So you've got the flexors and the abductors of the great toe, but there's no opponens muscle in the foot. And you've also got an adductor of the great toe, which is similar to the muscles in the hand. And you've got lumbricals, which are similar because they originate on the tendon of the extensor digitorum longus muscle, which is analogous to the flexor digitorum profundus muscle. So by looking at these kind of similarities, it makes learning about these muscles a little bit easier. So I'll just remove these muscles of the third layer, and we can look at the fourth and final layer. And this is an easy layer because it just includes the interosseous muscles. So you've got the plantar and dorsal interosseous muscles. So just like in the hand, the function of the interossei muscles can be remembered with the mnemonic PAD and DAB. So plantar adduct, adduct, and dorsal abduct. So I've just isolated the interossei muscles. So we've got plantar and dorsal interossei muscles. So the plantar interossei muscles lie inferior to the dorsal interossei muscles. So you've got 3 plantar interossei muscles. So there's an additional one shown here which doesn't exist. So you've got 3 plantar interossei muscles which originate on one side of metatarsals 3 to 5. So this is 3, 4 and 5, and they originate medially on the sides of these metatarsals. So these plantar interossei muscles are unipennate, so they only originate on one side of the metatarsals. And then they insert at the base of the proximal phalanges of digits 3 to 5, and also on the extensor expansions of these digits. So you can see, because of their insertion medially, they will adduct these three digits. So they'll bring it closer towards the midline of the foot. So the plantar interossei muscles are innervated by the lateral plantar nerve. So I just get rid of the plantar interossei muscles, and we can see the final set of muscles, the dorsal interossei muscles. So there are 4 dorsal interossei muscles, and these are a little bit different because they're bipennate muscles. So they originate on both sides of the metatarsals. So you can see here you've got dorsal interosseous muscle 2, 3 and 4 attaching laterally on the bases of proximal phalanges 2 to 4. So this will cause these bones to be abducted at the MTP joint. And then you've got this 4th one. So you don't have 4 plantar interossei muscles. So this first dorsal interosseous muscle inserts medially. So the second toe can be abducted either side. So the dorsal interosseous muscles abduct the digits 2 to 4, and they're innervated by the lateral plantar nerve. But you've also got the first 2 dorsal interosseous muscles receiving innervation from the deep fibular nerve. So those are the muscles, the intrinsic muscles of the foot. There's quite a lot to learn there, but the anatomy is quite similar in some respects to the anatomy of the hand, and a lot of anatomy is logically named, and if you think about it logically, it becomes easier to remember. So I hope that has made things a bit easier for you to learn